Welcome to this product demonstration video for the ALLTEST saliva drug test, the DSD-865. Now this is a new video we're doing because the pack contents has been changed on the latest batches. This is the standard manufacturer's carton outer. You'll see the catalogue code DSD-865, all the certification marks, lot number and expiry dates. Also on the outer package is the drug abbreviations for the drug groups included on this test panel. Now this is a 6-panel saliva drug test. The format's changed slightly, so when you open the contents you get the manufacturer's data sheet, which isn't included in this box because we're taking it out already. The familiar ALLTEST drug test carton pouches. Now these contain the actual panels. Again, on the reverse of these you'll have all the matching details for what's on the carton outer in terms of the abbreviation, lot numbers, etc. The familiar saliva swab collectors, firm rigid sponges on sticks with handles. And then what has changed is the collection chambers. This is the new foil wrap collection chamber. If we open this to show you the contents, there is a chemical strip in these now, which is a reagent which the saliva mixes with and has to be left in contact with for a full 10 minutes before you run the test. This is to increase the selectivity and sensitivity. It's part of the anti-clonal antibody reaction that goes on in these tests now to improve the certification and quality of the results that you're getting. Same format in terms of saliva collection. When you've collected your saliva, the swab goes down into this tube and discharges out into the bottom. You've got now a really nice clear indicator on the side of this bulb where the saliva collects. This is the marker. The saliva on the swab should be in excess or at least at that level for you to run all 3 membranes correctly. Once you've got that, the tube is shaken for 4 to 5 seconds and then left for 10 minutes. And when you're ready to run the test, this little dispenser on the top opens up, and then you use this as a squeezy bulb to dispense the 3 drops of saliva into the sample wells on the panel. We will show you all that in a minute to continue with this test and run you through how to interpret your results. So in part 2 of this video, what we're going to do is pop this pouch open, collect a saliva sample and show that being processed and the test running for you.